I am bumetanide, and together with ethacronic acid, we are going to introduce you again into another place in the world of pharmacology. So brace yourselves for new learnings. I, bumetanide, and ethacronic acid belongs to loop diuretics. But before we dig deeper into the discussion, I will tell you first why we are called so. We belong in loop diuretics because of our primary function. We function in the loop of Henle, and we are also referred as high-stealing diuretics because we cause a greater degree of diuresis than other diuretics. I am bumetanide, and bumetanide is my generic name. My brand names are Bumex and Diuretic. My chemical name goes this way. For my therapeutic classification, I am in diuretics. And for my pharmacology classification, I belong to loop diuretics. The Food and Drug Administration assigned me to pregnancy category C. Now let us go to my mechanism of action. The reabsorption of sodium and chloride is inhibited by myself in the ascending loop of Henle. It alters the transfer of electrolytes in the proximal renal tubule, which results to the excretion of sodium, water, chloride, hence diuresis. Now let us tackle my pharmacokinetics. I am 80% completely absorbed after administration. For my distribution, I am 90% bound to plasma proteins. 45% is secreted and remains unchanged when I undergo hepatic metabolism. I am 80% eliminated in the urine. My half-life is 1 to 2 hours. Now let us tackle the onset of my diuretic action following various routes of administration. For the intravenous route, my onset of action is from 0 to 30 minutes. I would take 0 to 40 minutes for the intramuscular route and 30 to 60 minutes for oral administration. I am used for the treatment of edema caused by heart failure, hepatic, and renal disease. I am contraindicated in patients who are hypersensitive to me or to the components of my formulation. Patients with anuria, gout, hepatic coma, and severe electrolyte depletion are also prohibited to take me. I must also be used with caution to patients who have hepatic cirrhosis and ascites, also for elderly patients who have decreased renal function. In the central nervous system, I may cause headache, vertigo, and dizziness. In the cardiovascular system, I may cause orthostatic hypotension. In the eyes, ears, nose, and throat would be deafness and tinnitus. In the genitourinary system, a possible side effect would be oliguria. In the metabolic aspect, it can cause volume depletion and dehydration, hypokalemia and hyponatremia, and elevated blood glucose level. In the musculoskeletal system, muscle cramps might be observed, and in the skin, rashes might also be observed. For your nursing assessment, you should assess the patient for any history of allergy to bumetanide or if there is electrolyte depletion, anuria, severe renal failure, or if the patient has hepatic coma, and diabetes mellitus. You should also assess the patient's skin for any lesions or edema, check the patient's vital signs, CBC, serum electrolytes, assess the patient's renal function, uric tests, and urinalysis. You can give the patient food or milk in order to prevent GI upset. Also, you should administer me in single doses in the day so that increased urination will not disturb the patient's sleep. Administer intravenous diuretic slowly to prevent severe changes in fluids and electrolyte. You can also give the patient a diet rich in potassium or supplemental potassium. Monitor the patient's compliance to my therapy, and most importantly, monitor the patient's response to my effects by taking vital signs, serum electrolytes, checking the patient's hydration, and patient's weight in order to determine my effectivity. And that is all. Now that you already know me, I will now pass you to ethacrinic acid.
Hi, I am ethacrinic acid. My brand name is Ediquin and my chemical name is this. By drug classifications, I am classified in therapeutic as a diuretic. In pharmacologic, I am classified as a loop diuretic. In pregnancy category, I am classified as a category B, which is safe to use during pregnancy. In my mechanism of action, I prevent the symptoms of sodium, potassium, and chloride. Excretion of these ions increase urine production, and reduction of extracellular fluid result from this pharmacological action. By lowering plasma and extracellular fluid volume, I often initially lower blood pressure, decreases cardiac activity, explaining its antihypertensive action. Eventually, with an associated decrease in peripheral resistance, cardiac production returns to normal. My mode of action does not require inhibition of carbonic anhydrase. In my absorption, I am absorbed easily from the GI tract. In my distribution, I am accumulated in the liver, and I am metabolized by the liver into a metabolite which is potentially active, and excreted 30 to 65% as a metabolite in urine, and excreted 35 to 40% in bile. My period of operation after oral administration is 6 to 8 hours and approximately 2 hours after IV management. I am indicated for the treatment of high blood pressure, edema caused by the diseases such as heart failure, kidney failure, and failure of the liver. I am contraindicated in patients who have anuria, history of severe watery diarrhea, and infants. In effects on gastrointestinal, I may cause anorexia, malaise, discomfort or pain in the belly, dysphagia, nausea, vomiting, and diarrhea. These are more common for large doses or after 1 to 3 months of continuous therapy. For metabolic, hypokalemia, hypocalcemia, hyperglycemia, and impaired glucose tolerance may occur. In cardiovascular, there has been dehydration, volume loss, and orthostatic hypotension. In hematologic, I may induce agranulocytosis, neutropenia, and thrombocytopenia. In special senses, I may cause deafness, tinnitus, vertigo, with a sense of fullness between the head and blurred vision. In the central nervous system, confusion, exhaustion, vertigo, headache, fever, malaise may occur. And lastly, in genitourinary, oliguria, hematuria, nocturia, polyuria, azotemia may experience. Other adverse effects include chills and skin rash. First, Ask the patient if digoxin is taken because digoxin toxicity will increase due to the depleting effect of potassium. Acquire a full history of health, most especially in electrolyte balance and renal function. Obtain vital signs, especially blood pressure, with the baseline values. To prevent drug interaction, find out the description history of patients, including the alcohol and nicotine intake. Determine the patient's potential drug allergies. Obtain specimens of blood and urine for laboratory examination. Watch for any consciousness transition, dizziness and exhaustion, and postural hypotension. Track by calculating intake, output, and daily weight for fluid intake. Track laboratory values, in particular, levels of potassium and sodium, and serum uric acid. Hearing and vision monitoring, since certain loop diuretics are ototoxic. Patient examination for any skin rash and discontinuation after any rash occurs, and HP consultation.
Thank you for listening and watching. We hope that you have learned so much from the both of us. Always remember to keep all of those things in your mind, and it is guaranteed that you and your patient will always be safe. See you in the next journey.